The problem I chose is heart disease, and the countries that I chose are the United States, the United Kingdom, and Turkey. I chose this problem because I know people with heart disease, and I chose these countries because they're interesting to me. So what is heart disease? Heart disease is several types of heart conditions, most commonly being coronary artery disease, which causes heart attacks. What causes heart disease is high blood pressure, high LDL cholesterol, smoking, unhealthy eating habits, and physical inactivity. The history in the US, it's the number one killer, but it was not always this way. It's so common because of the way Americans live. In the UK, it causes a quarter of the deaths, but it is improving. And in Turkey, it's one of the leading causes of death. Who is this problem targeting? It's targeting women. 1 in 14 women will die from heart disease, which is more than men. And it's also targeting racial and ethnic groups. They're more likely to die from heart disease than white people. Is the problem improving or worsening? In the US, it was improving, then it worsened during the pandemic because everyone was stuck inside, feeling isolated, didn't want to do anything. And in the UK, it's slightly improving, but not by much, and that's the same with Turkey. The US and the UK are developed countries. This means that it's a high income country that has a high quality of life. And Turkey is a developing country, which means that it has lower human developmental index than other countries. The US has private health insurance and public health coverage, which means that it's paid through work and other ways. The UK has a national health service, which means that it's paid through taxes. And in Turkey, it's a universal healthcare system, which means that everyone is covered. The Quad model, the US is improved outcomes and improved patient experiences. In the UK and Turkey, it's low costs. And this makes sense because the US does not have a national healthcare system, so they have to pay more, but the outcomes are better. So the goods. In the US, the goods are advanced medical knowledge, high quality staff, and short wait times. In Turkey, it's primary and emergency care are completely covered. And in the UK, it ensures that everyone can get the care that they deserve because they don't have to pay. The bads, the US, poor access to care and poor administrative efficiency. In Turkey, there's long wait times and poor access to care. And in the UK, there's also long wait times and poor access to care. So similarities, heart disease plays a huge role on the number of deaths in all these countries. Heart disease is improving, but not by a lot. And in all the countries, women are more likely to die from heart disease rather than men. The differences is that UK and Turkey have national healthcare policies, which means that if someone is suffering from heart disease, they can get the help they need even if they can't afford it, which is unlike the US. And the US spends the most amount of GDP on healthcare out of all these countries. So what's causing heart disease in these countries? The main cause of heart disease isn't genetic or can't be contracted, so societal characteristics play a huge role. And there's also a lack of education about eating healthy and exercising, which is making the problem worse. So what are the healthcare systems doing? Like I said before, the UK and Turkey both have national healthcare policies, so anyone can get treatment that they need. But the US does not have this, so people have to pay out of pocket, so they're less likely to go get help. What are the governments doing? The main thing that the governments are doing is trying to educate citizens about eating healthy and exercising. And the US and Turkey are also lowering the cost of preventative screening and treatment for those with risk factors. What should the governments be doing? They should be providing accessibility and timely use of health services for people with risk factors. They should be emphasizing social and environmental conditions that cause heart disease, and they should be encouraging citizens to frequently go to the doctors. Why is it more common in the US? The US has an obesity issue. 34% of adults and 20% of children in the US are obese. When heart disease was not the number one cause of death, obesity rates were way lower than they were now. Why is it not as common in the UK and Turkey? These countries have more opportunities for physical activity than the US. It's more common to walk around, to go to places, and to driving because the way that it's set up. And these countries also have less of an obesity issue than the US. So why is something changing? Heart disease is a problem that people can only fix by bettering themselves. Governments are spending too much money on other things rather than focusing on the issue that kills many people. They just don't really care to help fix the problem. All these countries have different factors, like if they're developed or developing, if they have national healthcare policy and populations. Even though they're all different, they all have one thing in common, which is heart disease. And the number of deaths caused by this are very high, and something needs to be done about it.